want to confirm that you can hear me and that you can see my slides.
Yes, I can hear you, sir. You're audible, sir. I can hear you.
Thank you
Yes,
so
sir, we
much.
can hear you and we can see your screen.
Okay, so I'll go on now to talk to us about this in a few minutes, and I'm hoping that we can use the rest of the time to discuss and answer questions and clarify some issues. I'll just give a short background. I started radiology with very little knowledge about what's really going on inside. It was more out of curiosity than knowledge of what it entails. Um, a lot of the things I found out about radiology were things that I learned on the job. And I can tell you that it would have been better if I had some information about the entire system before getting into it. As is always the case, people who have information, they move faster, they get their things together faster. And trying to group around and figuring out your way may eventually slow you down or make things a little bit more difficult than they usually should be. So I think it's very important that we're having a discussion like this, especially for people who are about to get into the system or people who are considering taking up this specialty, or even people who are already in the system but are at different stages of their training in this profession of radiology. So I am hoping that all these categories of people will find one or two things to take away from our discussion today. And if you had been groping in the dark concerning certain issues, you should be able to get some things cleared up here today. All right. So I will talk to us about what the program looks like. There are two colleges that are accredited, or they are enabled by acts to get residency programs in radiology going, and that's the National College, dubbed as the National Postgraduate Medical College of Nigeria, and also the West African College. Clearly, the West African College would include other countries like Ghana, Sierra Leone, Liberia. And these colleges do not just offer only radiology residency. Other specialties are also part of the things that they cater for. But radiology is a faculty within this college, and all their proceedings are governed by the rules of the college. So the entry point into any of these colleges is what we call the primaries. And that is an examination that people who are intending to specialize in any specialty have to write an exam called primaries. And you have to specifically state which faculty you are interested in. So if you are interested in joining radiology, you have to write the primaries for radiology. If you are interested in another faculty or another specialty, you have to take the specific examination for that faculty. Once you've passed that examination, then you are ready to start at any of the accredited institutions that offer residency in that particular specialty. So one point to note is that the primaries for radiology, for the Faculty of Radiology, can gain you entry into either radio diagnosis or radio oncology. I am in radio diagnosis. I have colleagues in radio oncology who came into the program with the same primaries exam that I wrote. So currently, the same exam takes you into either section of the Faculty of Radiology. So these are the two colleges, as I have said, and I've included their website addresses. I'll just say that for the National Postgraduate Medical College of Nigeria, there is a current glitch on the website. So if this does not go, it will soon be resolved. There is a temporary link that has been provided, but I'm sure that in the shortest possible time, the original website will be back up and running, and that is why I've decided to share just that with us. So information about the colleges, different faculties are actually available on these websites, faculty by faculty. Anything you need are there. There are also contacts that you can reach out to get more information on anything at all, ranging from exams to any clarifications from the colleges. So the residency program in general for radiology is a 5-year track program. And generally now, the two colleges are restructuring with a new curriculum that has already taken off. There are still parts of that curriculum that has not fully gained ground, but in some years to come, there's going to be a departure from what we've always known as the program to something that is more modern and something that is more applicable to our needs generally in medicine. So the first 3 years are designed to train residents in general radiology, and it is called a membership program where the residents who finish these 3 years of training are called members. So they are specialists who can exit that program at that point.
Sorry, sir. Please, can you increase your volume? It's not very loud. We've had some comments that they really can't hear you. Thank you, sir.
Okay.
Dr. Fatade, please, are you still with us?
Yes, I'm trying to adjust my
Okay,
sound.
this is way better. Yeah, this is very good. Thank you. Thank you so
All right.
much.
Sorry, I just discovered my output volume has been low on the system. I have fixed that. Thank you. All right. So most of what I've said earlier is that I've shared the website addresses for the two colleges that are involved in training residents. And I have talked about the fact that the entry point into these colleges, into the residency program, is the primary exam. And the primary exam for the Faculty of Radiology admits into either radiodiagnosis or radio-oncology. I am in the radiodiagnosis section of the Faculty of Radiology. And you can enter into this program at any of the accredited institutions that offer residency in these programs. I said that it's a 5-year track program. The first 3 years is dedicated to general radiology, and it is a program that people who complete the first 3 years can exit the program when this curriculum has fully gained ground. Currently, people write membership exams, and they become senior registrars. In the remaining 2 years of the 5-year track, you are expected to pick a subspecialty that you are interested in specializing in, and then you spend about 6 months as a senior registrar doing general radiology, and then the last 18 months of the remaining 2 years will be in the subspecialty of interests, meaning that you will not be rotating through other subspecialties. You will be focused on that subspecialty that you want to qualify in, and stands to reason that whatever thesis that you're doing will be in that subspecialty of interest or choice. The other thing that is also more recent is the MD program. It's a Doctor of Medicine program and is hosted by the National Postgraduate Medical College of Nigeria. It is more rigorous than the fellowship dissertation. So it is a program that is academic. And just to put in perspective, the current fellowship dissertations, if you look at the word count, for example, it can range between, say, 13,000 and 20,000. For the MD program, the minimum required word count is 50,000. So there is that expectation that surpasses what is obtainable in the regular fellowship dissertation. The MD program is a 2-year program, and it is advised that immediately anybody finishes the membership program, they indicate interest in the MD program so that the completion of that MD program also matches the duration of the subspecialty training that they are interested in. You would be required to write a proposal. It starts with writing a concept note, picking a topic. Topics are generally expected to be more advanced than the observational studies. They should be experimental. They can be randomized controlled trials or something a little bit more encompassing of other specialties. And then when such a topic is approved, you'll be given a timeline, about 3 months, to submit your proposal for that work. When approved, you can then proceed to write up more sections, to collect your data, analyze, and then present your final work at the end of your program. The little detail that the MD program brings in is that you have to finish that program and defend your thesis before you can go ahead to write your fellowship exam, minimum of 6 months apart. Say you start your MD program now, you finish in 2 years and defend. Successful defense then gives you the permission to write your final fellowship exam in the subspecialty 6 months after you have defended the MD thesis. And exiting that program, you will then have a fellowship qualification, which will be the FMCR, Fellow of the Medical College of Radiology, and then an MD degree, which is the Doctor of Medicine in the subspecialty that you have completed that in. So that's like a general overview of what the residency program looks like. For the primaries, the focus or the content is physics, radiological physics, and anatomy. For the junior residency, radiological physics is still expected, and it will still feature even in the examinations, anatomy and technique of imaging, and then clinicals. And then the MD fellowship and subspecialty runs concurrently for anybody who is in these programs. I figure a lot of people will have questions on this particular section, and I will take them at the end of my presentation. All right, so the other things that are also to be taken note of in the course of these programs are the financial implications of being in training. So for people who are registered with the National College, everybody who is in the residency program under that college must pay what we call the annual fellowship associate dues. It is usually due by January of every year. And people should know that even if you come into the program after that time, you need to make payment for that year. A lot of people discover this when they are registering for exams, and then they have to pay penalty. So it's good to know this as you are going into it. The Sojourn in Training fee. So this is an annual due for the National College. The Sojourn in Training fees are is a one-time payment for every resident in the West African College of Surgeons. I need to also say that the primaries for the National College is different from that of the West African College. Not in content, but in the body that organizes it. And any of these can gain you entry into the residency program. You can have both. You can have one. Usually advised to have both so that you can participate in both colleges. But one grants you admittance. For people who have one already and are in the program, they can decide to write the other one or apply for exemption. And if approved, then they will be allowed to participate in both colleges. Also, in the course of the program, there will be update courses that you are expected to do. There will be clinical update courses and then radiological physics. So for the junior residency, radiological physics, one update that will be organized by either the National College or the West African College. As much as I know, there is usually an annual rotation of which college hosts that radiological physics, because it's usually just one for the year. So you need to make sure that you have it sorted before you can apply for exam. And for the clinicals, you need 2 clinicals. You must have at least one in the college in which you are writing the exam. So if you're writing a national exam for part 1 or membership, you must have one clinical national update, and then you can have others. So you can't just do West African updates and then put in that for the national, or do national and put that in for the West Africa. You must have at least one in the college in which you are writing the exam, and then the others can come from the other colleges. The MD program, I've already described what this is. There's also the possibility very soon that the Faculty of Radiology will actually have standalone faculties, as the radio diagnosis will stand alone and radio oncology will also stand alone. All right. Okay, I can see in the comment section. Thank you very much, man. Details of the content of radiological physics has been shared on the chat page, so we can take note of that. Thank you very much, man. Okay, the scope of radiology, there's so many modalities. Generally, a lot of people believe that radiology is just about X-rays. That's all they can think of. But there are so many other modalities that are involved in radiology. We have the conventional X-ray, which is what most people know. A lot of people also know the ultrasonography, usually dubbed as scans. And then we have others like fluoroscopy, mammography, computed tomography, magnetic resonance imaging, and interventional radiology. So radiology is also evolving from just the simple diagnosis to interventions. And there are indications where radiologists can perform certain procedures that will be therapeutic for the patient. Now, just an icebreaker. Looking at all the medical specialties, this is a mirror. And with a mirror in this room, it's not going to show you anything you have not already seen while entering that room. If you stand in front of it, you will see your face, which you may not be able to see otherwise. It has its uses. It's very important. But radiology is beyond just looking at a mirror. When we use our devices to look, we are not just trying to see a reflection of something or someone or ourselves. We're looking inside. We're looking beyond what is visible ordinarily. This other image shows us a suitcase and the contents are visible. This is used in airports, bag scanners. We can see what the natural eye will not see. There are different things in this bag, and we're able to pick it out. So if we think about this for radiology, without opening these bags, we can look inside without even touching the patient. And for the interventional radiology, you can even touch things inside without making an obvious opening in the patient. Consultants in radiology have been called a consultant's consultant, and this is why. Other specialties usually have to consult us for carrying out management of their patients or for guidance in carrying out the management of their patients. And sometimes they even collaborate with us to carry out therapy for their patients. One of the things that drew me to radiology was the fact that it gives you a piece of everything. You are not confined to just one system or one kind one set of practice, you can have a varied, almost like a salad of cases can come through to you on a daily basis. Until you subspecialize and then pick a particular place, you have the feel of all specialties. Everybody in the hospital actually has course to interact with radiology at one point or the other. All right, so this is just a chart to show us the intersection between all the different parts that I've talked about. And at the intersection between radiological physics and anatomy, we have imaging. Most of our equipment use the laws of physics to generate images, and then we are able to relate those images to the human anatomy and then detect departures from normal expected anatomy. At the intersection between anatomy and clinical medicine, we have diagnosis. So we know what the normal is, what the expected is. Any departure from that will either be a variant or an abnormality. And that is how we arrive at diagnosis. And at the intersection of all three of them, radiology sits written. So we have some emerging tentacles, and those are teleradiology and artificial intelligence. Artificial intelligence is permeating almost every nook and cranny of our existence, and more importantly, in medical imaging, it is driving the practice. It is changing things, and we need to understand it. So for everybody who intends to come into radiology, a good knowledge of artificial intelligence will be very important. It will give you an edge. It will make you understand the practice as it's evolving, and you will not be left behind in the coming years. Teleradiology is also having its own impact on radiology, and it is still in the formative years, at least as far as Nigeria is concerned. So in radiology, you must expect to work alongside other members of staff that are in other cadres and other professions. A lot of darkroom staffs are not as common as before because most of our machines are now digital and most centers hardly have a darkroom. But some places in the rural areas and even in the urban areas still have these dark rooms. You will also work with medical physicists. You see that radiological physics is part of the program, and the medical physicists are also an important section of the department and faculty. Imaging scientists or radiographers, they acquire images from these different modalities. We also have radiology nurses. It's a fairly recent inclusion as per the curriculum. And then we have biomedical engineers because our own specialty is majorly equipment and technology driven. So we need to have people who have domain expertise in these machines, in repairing them, in maintaining them, and keeping everything running. Now, there are so many opportunities in radiology, and they range from research opportunities, collaborations with computer scientists because of the involvement of AI, biomedical engineers, as I've explained, software developers. Part of what AI also does is to develop some computer-assisted or computer-aided diagnosis. And then there are some other softwares that are not focused on diagnosis, but they are focused on improving the experience of both the radiologists and every other person that has to work with imaging generally. Some of the machines we use, for example, they have different user interfaces. Some are easy, some are annoying to use, some are friendly to use, and it is all dependent on whatever is developed on those equipment that we use. And then medical equipment representatives will continue to approach anybody they believe is in the imaging space because they have one item to, launch or sell or push out for use out there. So these are people that you may eventually have to collaborate with when you're in the field of radiology. Okay, so another thing is the membership of societies. A lot of people are already in the program and they hardly participate in all these wonderful societies. They offer a lot of knowledge. a lot of networking, and a lot of research focus. So for Nigeria, we have the Association of Radiologists in Nigeria, and every resident is automatically a member of this association. Then there are affiliates of this association, and they are mostly subspecialty based. I'm a member of SPIN, that's Society of Pediatric Imaging in Nigeria, and also the current PRO. I'm also a member of Nigerian Imaging Informatics Society. And then there are other societies as I've listed, and there are still many more. This list is not exhaustive. There are also international bodies that offer membership, associate membership to their own bodies. And for most of these societies, you can actually get access to their materials for free as long as you're a resident. The moment you stop being a resident and you become a fellow, a consultant, you actually have to subscribe. So it's always good to know these things and know that there are opportunities. You can attend their conferences at subsidized rates. You can get some materials from them for free. They can sponsor some part of your training, depending on your level of involvement in their activities. So my recommendations to anybody who hopes to join the field of radiology will be that you must find a mentor. It's very important. It's very important. Let there be somebody who can walk you through, who can show you the way, who can guide you. And the field of radiology on its own is like is not just a specialty, it's like a career on its own that has so many tentacles. And you may get distracted trying to do this, do that, but you need to focus and then get your gig together to be able to bring the best out of all those things. And then research participation is also very important. That is about the currency that shows all your efforts. You can do a lot and then there's nothing to show for it. And a lot of people are just focused on doing this program, finishing the program, but you discover that the people who do this program and have a lot to show for it in terms of research, they tend to come out better. They tend to have more reward for their labor, as many as they are. So I would encourage everyone to be involved in research. And then to the colleges, there's also a lot that residents are doing, that fellows are doing, but because there are no particular, certifications for the different aspects of imaging, it seems that it's an all or none thing. So until you get to the finish line where you are called a fellow, there is nothing to say that you are very good at this field or you are very good at that field, or to say that you are certified to do this, you're certified to do that. So I believe that the colleges can, restructure in such a way that there is something to say that this person is certified in this and certified in that, even before getting to the final finish line. And then global integration and convertibility is it's getting better, and it will be good if it continues to get better, that all our certificates, all our qualifications acquired here from Nigeria are also easily convertible. In reality, a lot of people who have trained here have found it easy to work anywhere, even in the field of radiology. But we need to, make it institutional and not just personal experiences for people who have been able to go there. Okay, yes. So one of the other RN affiliates that I did not include is the BSON, Breast Imaging Society of Nigeria. Yes, very, very, very correct. There are a lot of others that I may not remember or I did not remember to include in this presentation. All right. I must thank the faculty chairman of both the National College and the West African College, who I reached out to get some more information, and they offered important information that helped me in putting this together. And one of them is on the call and has been giving us details in the comment section. That's Professor Agunloye. Thank you very much, Ma. And also Professor Akela, the faculty chair of National Postgraduate Medical College. I'm grateful for your support. Yes, and also one of my teachers is here, Professor Atalabi. Thank you very much. Yes, there is certification for membership. Yes. So that is, I missed that out. I do not have that certificate. I'm part of the old curriculum as it is. So for all those who wrote exams recently in the last few years, they have certificates for membership. Yes, they have certificates for membership, and they are now currently senior registrars. That is very correct. Thank you very much. So that is the end of my presentation. I thank you all for listening, and I will then sit back and wait for questions.
Thank you so much, sir. Thank you very much for that wonderful presentation. Very informative. Thank you. So now would